The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with our co-host, Otto Lohse. How are you today, Otto?
Nice, very good, thank you. Always good to be here.
Always good to have you here.
Yeah.
Also, we have Kristina who is our radio show producer, who brings these wonderful guests every week, almost for 11 years. So, and we're doing pretty well. So welcome everybody. And I'd like to especially welcome our guest today and really thank you so much for taking a full hour with us. Hopefully you were made aware that you'll be with us for an hour. Dr. Mary Parisi, and Dr. Parisi is a dermatopathologist. So I want to thank you so much for coming and talking to us today. And you're with Northwell Health. And I know today's subject is really a good one, especially because it's skin health for seniors. So our skin's always changing, and especially as we age, it seems like almost every day it changes. I don't know about you, Otto, but it seems like every day
I'm a poster child for
something new.
what you shouldn't do or should not have done. I've been through it all. Yeah.
So again, welcome so much, Dr. Parisi.
Thank you so much.
Before we even started, I was kind of, had to ask you how to actually pronounce dermatopathologist. So if you could just maybe even start off a little bit with what exactly is a dermatopathologist?
Sure. Well, first of all, thank you so much for having me. So dermatopathologist, if you break the word down, dermato is skin. Pathologist is the study of diseases. So a dermatopathologist studies the diseases of the skin. And on a daily basis, what most of my day entails is examining skin biopsies. So for example, if you were to go to your dermatologist and they saw something on your skin that looked atypical or just concerning, and they wanted to do a skin biopsy, what they would do is usually a punch biopsy or a shave biopsy, and basically just take a little piece of the skin. Then they put it into a jar with fixative, usually it's formalin fixative. They send it off to the laboratory. The laboratory will process the tissue, put it onto a slide, and then I'm given the slide and I look at it under the I look at the tissue under the microscope and render a diagnosis, evaluate the tissue, interpret the findings and make a diagnosis. And then I write up a report and send the report to your dermatologist. Your dermatologist will then tell you the findings and discuss a treatment plan.
How does that work? Like I've had the unfortunate pleasure of having 2 Mohs surgeries. And when they do that, they actually do the lab part of it, I guess, right there to determine if they have to go another layer down. How does that fit into this kind of thing? I'm just curious.
Well, Mohs surgery is also called tissue sparing surgery. And what they're doing is at the time of the surgery, they're looking in the microscope. And the main reason they're looking in the microscope is to make sure that the margins are negative. So in other words, let's say you had a positive margin, meaning that so your surgeon took a little piece of your skin and he looked at it under the microscope, or she looked at it under the microscope and saw that tumor still extended to the margin, the edge of the area that he excised. So that means he would go back in and take another little piece and repeat. He would take another little piece and look at that under the microscope until there's no more tumor left. So it's a wonderful, wonderful procedure because you're saving tissue. He's removing the least amount of tissue so that you're removing the least amount of tissue until your margins are negative, because you don't want tumor to extend to the margin. You don't want to leave any tumor behind in the patient.
Yeah, mine was 5 times down, so it was an all-day affair.
They had to resect it 5 times.
Yeah. But
Well,
I'm still here, and that was quite a few years ago. So maybe they did, not maybe, they obviously did a good job, because there's been no after effects other than a little bit of a dent in my head, which
no recurrence.
they had that anyhow.
So it seems like there is stages in life that we all go through where we see a lot of changes in our skin. And I am noticing a lot in my late 50s, really a lot of kinds of new things that are popping up. And I'm really good. I go to my dermatologist, so everything is cool. So is there, like, are there things that as we age, we should be expecting? I think, like, we're not made aware, like, okay, you should probably expect some age spots, some different things happening to different parts of your body, like your hands, So, when we're younger and things pop up that are unusual, it's like, seems like it could be a little bit more serious. I don't want to say serious, but, and as we get older, it's almost like a natural occurrence.
Well, yeah, I mean, as we age, there are changes that happen to our skin. The skin tends to become drier. It can thin out. It can be blotchy. You can get age spots. Some people start losing their hair. It can be irritated more easily, bruises more easily, and healing may take a little bit longer. And then your risk of skin cancer increases, especially if you are a tanner, you like the sun, and you're not protecting your skin from the sun. The accumulation effect of the UV radiation can affect your skin, and you'll see it over time.
Well, seniors in my generation were pretty dumb when it came to what the sun could do to you. We did everything in our power to make it so that it would be bad now, and that's a fact of life. So I think, like from a senior perspective, what can you do about that? At this point, like, you've already created a lot of damage, if you will, which is not, you can't recover from it. It's done. Me, for example, I was in Cuba for 2 months in the Navy, never wore a hat, nothing. Sun, beating down on me, and always been an outdoor type. So what I did is done. I can't undo it. But what can you do at this stage, like when you've already done all the damage?
Well, sun protection is still important as a senior. And for 2 reasons. Actually, if you start protecting, your skin has the natural ability to protect you from some of the damage to the sun. So if you start protecting your skin, you might actually be able to undo some of the damage. And more importantly, you can prevent your skin from getting more damage. You want to do common sense things to stay out of the sun. So, and remember that the sun is hottest between 10 a.m. to 2 p.m. So you want to seek shade, wear a wide brimmed hat. If you can, you wear gloves, that would be extra protection. Sunglasses with UV protection, which also, it can protect you from some eye diseases. you want to use a broad spectrum sunscreen. So when I say broad spectrum, I mean the sunscreen should have UVA and UVB protection. And the American Academy of Dermatology recommends at least an SPF of 30. And then also important is to avoid tanning beds or sun lamps, because the tanning beds and sun lamps can do as much damage, if not more damage, than the sun. So it's actually never too late. Seniors need to recognize that it's still important to protect themselves from the sun.
When you say broad spectrum, is there like, you walk into a place or you go online, whatever, there's 150 different kinds of skin protection that each one is better than the other. They're all great. And your skin is going to be like you were 14 years old again. Is there, there's some guidelines, like a basic question I have is a spray versus a lotion. Like there's a lot of sprays out. There's a lot of stuff that you rub on. Just stop with that top level even. Does it matter?
So I think the quick answer is whatever you'll use. If you tend to prefer a spray, then buy the spray. If you tend to prefer a cream, then use a cream. The most important thing is that it's UVA and UVB. The bottle will say broad spectrum. Oh, and also it should be water resistant. Broad spectrum, water resistant, UVA and UVB protection. And then, I just also want to mention that if you're not too keen on using sunscreen, there's a lot of clothing that has a UPF factor in it. So basically, so let's say you bought a long sleeve shirt that has a UPF factor of 50 in it. So then when you go out, you just need to cover your hands and your face with sunscreen rather than your arms. And, if you had long sleeve, long pants on and they had a UPF as well, then you just have to, and you're wearing sandals and you just cover your feet. So whatever works for you is the best thing to do. And let's say you don't like the creams, then buy the spray, but you should cover whatever skin is exposed to the sun. And you should ideally repeat putting on this. You should put the sunscreen on 15 to 20 minutes before you go out and expose yourself to the sun. And then you should repeat the sunscreen every couple of hours. That's especially important if you're, let's say, on the beach or at the pool and you go swimming. Even if you have a water resistant sunscreen, you should still repeat the application.
Can that be combined with a skin moisturizer typically? Like I hear, some of them say they're a moisturizer and a sun blocker and a whole bit that goes along with it. Is there such a thing as everything in one package?
Yeah, like one-stop shopping.
Yeah, right.
Yeah, I think there are sunscreens out there that have a moisturizer combined with the sunscreen. So the key things that you need to look for is that the product says that it's UVA and UVB. It offers UVA and UVB protection, and ideally it's water resistant.
Dr. Parisi, can you just go elaborate a little further in what UVA and UVB is, and why, how come it's not just automatically in sunscreen? I mean, I get sun tanning lotion. It's very different than sunscreen lotion. What is, can you just elaborate a little bit further on those UVA and UVB?
So in general, when we think of UVA, so UV is ultraviolet. So these are the rays that are coming from the sun. And when we think of UVA, we think of the rays that are causing aging. And when we think of UVB, it's the sun rays that are causing burning. And so we're trying to avoid both aging and burning. And the cumulative effect of both of the UVA and UVB is the number one cause of skin cancer. So when you're using sunscreen, you're contributing to the prevention of wrinkles, but you're also protecting yourself from the risk of skin cancer.
Wrinkles are part of the problem as far as skin cancer goes?
Well,
Aging and burning.
let's see. So when you have wrinkles from the sun, that's an indication of how much UV damage you have. And the amount of UV damage you have correlates with your increased risk of skin cancer. So they're not directly related in that if you have wrinkles, you're going to get skin cancer, but they're related in that both wrinkles and skin cancer are a result of UV light, whether it's the sun, tanning beds, sun lamps. UV damage causes both wrinkles and skin cancer. And that's why it's so important to protect yourself from the sun. And also it's really good news about how to protect yourself from skin cancer, because skin cancer is one of the most preventable cancers. And that's because if you protect yourself from the sun, which is the number one reason or the number one risk factor for skin cancer, then you can prevent skin cancer. So it's actually very simple.
There's I want to say a misnomer, or like if you're someone who burns, I have a sunburn, versus someone who tans. Is someone who tans going to be less likely to have skin cancer? I mean, I know people that have tanned their entire life from birth with aluminum foil and cooking oil to crazy things back then. And I always burned, so I'm a little bit more conservative with that, but I would burn. So is someone who has burned in their youth should have more of a concern than someone who's like a tanner, someone who, I don't want to compare, I mean, someone who gets burned versus someone who gets tan. And you know what, when we come back, we do have to take a quick break. We can talk a little bit more about that. And of course, other things related to skin health for seniors. So we're speaking with Dr. Mary Parisi, who's a dermatopathologist from Northwell Health, and we will be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, along with co-host Otto Lohse, and of course, our radio show producer, Kristina Lu. We're speaking with Dr. Mary Parisi, who is a dermatopathologist at Northwell Health, and learning all kinds of information about ways just about skin health in general. In particular, right now, we've been talking a lot about the sun and sun damage. So before break, I was kind of asking you, are people who burn more, I don't want to say more likely to get skin cancer than somebody who would tan?
So if you have, we call it type 1 skin, or if your skin is pale, you're a natural blonde or redhead, and you tend to burn, your risk of getting skin cancer is higher than if you tend to tan rather than burn easily. However, anybody can get skin cancer.
Right.
There's other factors such as genetics. I mean, anyone, including people of color, everyone is susceptible to getting skin cancer. But yes, your risk is higher if you tend to burn, and especially if you had 5 or more sunburns, especially blistering sunburns when you were younger in teenage years, that significantly increases your risk of skin cancer. So yes, it does make a bit of a difference if you're light complexion and tend to burn, but your risk is not eliminated just because you are able to tan as opposed
Right. Another question, and then I want to also get on to other kinds of skin conditions and issues that affect seniors, people as we age. Is there anything that you can do after, if you've had a bad sunburn and you realize, oh my gosh, I've got a really bad burn, is there anything that we could do after a bad burn, or even just a lot of exposure to the sun that maybe unexpectedly happened, that we can do to kind of decrease the impact of the burn or that tanning?
I think that the best thing that you can do is just stay out of the sun and follow very careful sun protection guidelines, seeking shade, wearing sunscreen. I mean, you really should be wearing sunscreen every day, 365 days out of the year, because even if it's cloudy, 80% of the UV radiation still comes through the clouds. So you might not feel like you're being exposed to sun because it's not a sunny day, but you actually are. So if you have had a sunburn, the best thing that you can do is just be very vigilant in practicing sun safety. The American Academy of Dermatology takes the position that no tan is a safe tan. There is no tanning. If you want a tan, you should use one of these sun tanning products that you can get, in the drugstore, but you should not be tanning from the sun, because the UV radiation does a lot of damage, has the potential to do damage.
No, I actually do put on something every morning, a brand name Eucerin, which has an SPF 30, but I have no idea about the UVA and the UVB, which I will look at after the show. I've been using it for years after I did all the damage, and I'm outside a lot, so it's very hard to, basically be covered all the time. I like to play golf. It's very difficult to be completely covered, at least in my judgment. I mean, you can do it, but it's not easy. We have a lot of different, if we had cameras, I could show you 40 different kinds of marks that I have managed to create over the years. And you try to look at them and say, okay, that one looks okay. This one doesn't look so good. I'm a pretty regular goer to a dermatologist, but is there any way you can kind of self-analyze some of these things?
Sure. And let me just say, Otto, that I would strongly recommend that you get clothing with UPF when you go to play golf, because that will help with the sun protection immediately. But to answer your question, it's always a good idea to do a self-skin exam. The American Academy of Dermatology recommends that, they say, examine your birthday suit on your birthday. So if you haven't had any skin cancer, once a year, to examine your skin once a year is a good idea. If you have a history of skin cancer, your dermatologist will most likely recommend even for you to go into the dermatologist's office, and he'll give you a schedule depending on what kind of history of skin cancer you have, either every 3 months or every 6 months. So patients should be doing their own skin self-exams, and they should visit the dermatologist for a skin exam. And the American Academy of Dermatology also has what's called a body mole map, and you can get that from their website. They have a really wonderful website for the public, and it's easy to remember, aad.org. And that is a wonderful way to keep track of any unusual spot that you see. And that's probably, we have non-melanoma skin cancer, we have melanoma, but the common denominator between all skin cancers is that you're looking for a change. If you see a spot and you notice it's like maybe bleeding and it's not healing, or it's changing, or it's different from the other spots on your body, those are the ones that you have to be concerned about. And this body mole map is actually really wonderful because they have a whole little map of a person on the map, and you're supposed to put a little mark and then where you find something, and then note how it looks and if it's changing. So for example, we have the if you're concerned about melanoma, we have the ABCDEs of melanoma, which basically describe what you should look for, and it's kind of common sense. Okay, so A would stand for asymmetry. So if the spot that you see, if you drew a line down the spot that you see and one side is different than the other side, then that spot is asymmetric, and that could be worrisome. And then you look at the border. If the border is not smooth and well circumscribed, if it's scalloped, for example, that's a concerning sign. And you look at the color. Is it uniform in color? Does it have multiple colors? If it has multiple colors, that's a concerning sign. And then diameter. If the spot is greater than 6 millimeters, we like to use the tip of the pencil, the eraser on a pencil, as a guideline for size. If it's greater than the size of a pencil eraser, that's concerning. Although keep in mind that melanoma can be smaller than the 6 millimeters, but these are just generalizations. And then E is for evolving. So as I said, if you have a spot that looks different from the other spots, that's maybe one you might want to talk to your dermatologist about. And evolving, if it's changing over time. So those are the signs to look for melanoma. But for other skin cancers, the common denominator is it's a spot that it's not going away. Even if it looks like, for example, basal cell carcinoma can look like a scar, but all of a sudden you have a scar on your face. That's concerning. Or if something keeps bleeding and not healing completely, those are concerning factors.
Does something start as melanoma, or does it grow into melanoma? My understanding, melanoma is like the bad one. That's when you're the heavy duty cancer, if you will. Does it start that way, or does it kind of grow into it?
Well, it can happen either way. So melanoma can evolve from a mole or a nevus, an atypical nevus, or it can occur de novo. The number one risk factor for melanoma, just as for squamous cell and basal cell carcinoma, unless you have, a medical condition like xeroderma pigmentosa, where that's a genetic condition. But in general, UV radiation is the number one risk factor for the evolution of melanoma. So to answer your question, Otto, it can occur either way, de novo or from an existing mole that, with repeated hits of UV radiation, or a mutation occurring for, I don't know, maybe another reason, but it can occur either way.
But it's the worst one, right? You kind of get into degrees of severity, and that would be.
So when we talk about skin cancer, as I mentioned before, we talk about non-melanoma skin cancer and melanoma skin cancer. And melanoma is the worst because you have the greatest chance for it to metastasize. So basal cell carcinoma is the most common skin cancer. And the good news is that it almost never metastasizes. It can, but it almost never does. However, it's very important to nip it in the bud and get rid of it. If you think you have a basal cell carcinoma, and what we look for, the classic description of a basal cell carcinoma is a pearly papule. But basal cell carcinoma can look like a scar, can look like an acne scar, it can look like a pimple, but you want to have that removed because it can cause a lot of local damage. If left untreated, it can invade, through basal carcinoma occurs at the cells which are at the base of your epidermis. This may be getting a little too technical, but the point I'm trying to make is that it can invade into your skin, into nerves, even as far as bone, if people let it go too long. So it's very important to, so the good news is it almost never metastasizes, but you do need to take care of it. Squamous cell carcinoma, I'm sorry, you can say.
I was going to say, though, this is a really good message, because I know a lot of people who don't go to the dermatologist because they're afraid. So, I mean, the end result of putting it off could be, it just keeps getting, worse
You
and
lose
worse.
a piece of your ear or whatever, which I have seen with a number of people.
Yeah, I mean, the earlier you treat skin cancer, the better the outcome. Skin cancer is curable. Even melanoma is curable. In fact, if you detect melanoma, which is the deadliest of the skin cancers, you can have a 99% 5-year survival rate if it's detected and taken care of early enough. As I was saying, squamous cell carcinoma is sort of in the middle because it can metastasize. And one thing to remember about squamous cell carcinoma is that precancerous lesions called actinic keratoses also need to be taken care of because they can evolve into squamous cell carcinoma. So the bottom line, though, is that skin cancer is one of the most preventable cancers, and it's highly treatable when found early and taken care of early. I mean, if you have a basal cell, you don't want it to sit and fester and, start growing and causing potential damage. And the same thing with squamous cell or melanoma. You want to take care of them right away.
I've had like when you go to a dermatologist, a lot of times they zap, if you will, they spray it, or they suggest the term that I had was a cream Effudex. Are these approaches for what we just talked about, like this AK and basal cell and whatnot, if it's in its early stages, or when do they do that, if you will? Like where they spray it and What makes that decision like, I guess?
So, there's lots of different ways that you can treat skin cancer, as you were mentioning, Otto. So freezing it is cryosurgery. Zapping it is electrodesiccation, which is heat. And then sometimes a dermatologist will do a combination. They'll shave it, send the specimen to me, and then they'll zap it and fry the base, so that in case any, it's there, let's say they have a high suspicion that it's a basal cell carcinoma. They'll shave it, send it to the lab for confirmation, and then they'll zap it just in case there are any neoplastic cells left behind. So to answer your question, if a patient has a lot of actinic keratoses, for example, on their face, their scalp, let's say they're balding and they're getting sun damage on their scalp, it's, this is a decision between the patient and the doctor, but I would say that it's probably considered efficient to use a cream like 5-FU, which is Efudex, because it will cover a lot of area.
We have to take a quick break, Dr. Parisi. We'll come right back to discussing skin health for seniors. You're listening to Project Independence in You on Community Talk Radio, 88.1 FM and WCWP.org. We will be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and, of course, Kristina Lu. And we're speaking with Dr. Mary Parisi, who's a dermatopathologist and is working over at Northwell Health. And we're talking about all things really sun damage and skin cancer and related. And I know we were right in the middle of a response just before we had to take a quick break. So if you wanted to continue, Dr. Parisi.
Sure. So Otto was asking about the different ways that skin cancer can be treated and how do you decide which way to treat the skin cancer. So, and in particular, such treatments such as 5-FU or Efudex. So, and what I was saying is that it's an efficient way if a patient has many, for example, actinic keratoses all over their face and their scalp, you spread the cream on and that will help take care of many lesions at the same time. The alternative is, for example, if you only have an isolated lesion or one or two, then the dermatologist might choose to freeze it off with cryosurgery or shave it and then electrodesiccate with heat the base of the lesion. So I think it's a combination of, well, it's really depending on how many lesions you have and what lesion he suspects it to be. So for example, or he or she, for example, if you have a melanoma, you would never want to freeze a melanoma. A melanoma, for example, if there's any, if the dermatologist is concerned that the lesion might be a melanoma, then they would usually do a biopsy. They would not freeze it, they would not burn it, they would send it to the lab for histologic evaluation. Sometimes it's shaved or either a shave biopsy or punch biopsy, or even an excision right off the bat, because the number one prognostic indicator for melanoma is how deep it is. So, so it depends on, so the treatment it depends on what kind of lesion the dermatologist suspects it is, and how many of the lesions that you have.
So you can tell from the incision or what they send you, I guess, where it's at and how deep it would be. Like is it you're able to stage the melanoma from from the sample that they take from the patient?
So when we evaluate a melanoma under the microscope, what we look, the three main prognostic factors that we look for are how deep is the melanoma, how mitotically active is it? In other words, how fast are the cells multiplying? We count the mitotic figures. So, we report the number of mitoses per millimeter squared. And then also, is it ulcerated? And we give what's called a pathologic stage. And that's a little different than, what you're going to talk to your doctor about, because the pathologic stage gives information about what we're looking at under the microscope. But then the big picture is evaluation of whether the tumor has spread. So, sometimes under the microscope, we can see, or we, included in the differential could be that this lesion could be a metastasis. But we don't have a way to know whether your tumor has spread to lymph nodes unless the lymph nodes are examined. So unless we're sent, for example, you'll usually get a biopsy done, and then the doctor will do an excision, and depending on how deep the melanoma is, they may or may not do a sentinel lymph node biopsy, and then from there, if the sentinel lymph node biopsy is positive, then they might do a regional lymph node dissection. So staging is the staging that I think you're talking about, which would be what your clinician discusses
Right.
with you, would include how many lymph nodes are positive, where are they located? Is it are they regional lymph nodes that are positive? Are they further away from the tumor? So all of those factors are related to how the patient is staged.
So
good.
I was just going to say, we, in our last segment with Dr. Parisi, I know there's a lot of important information about what you're providing, but I do want to also talk a little bit about other aging skin type issues and ways to kind of, I don't know if we can prevent it, but at least not make it worse. I was reading some of your information, which I thought was interesting, using warm water and not hot water. Things like that kind of can maybe hold things at bay a little bit longer. Are there things that, we could be doing to kind of, keep things, at bay?
Well, I think what you're referring to is, some of the changes that happen to the skin as we age. Okay, so as we age, our skin becomes drier and thinner, and almost paper-like. And so dry skin is a very common symptom, and it's very common to want to alleviate your dry skin.
Right.
But there's so many easy things that you can do to help with the dry skin. So for example, when you're bathing, I think the overall idea is to keep things gentle. So instead of taking a shower with hot water, use warm water. And instead of taking a really long shower, limit the shower to maybe 10 minutes. Instead of using a bar soap or an abrasive kind of soap, use a soft, gentle cream. And, avoid buff puffs. Use a soft cloth. And, one key thing to keep your skin nice and plump and retain the moisture is to, after you get out of the shower, you pat yourself dry, just leave a little bit of moisture on the skin, maybe 3 minutes after the shower, and moisturize with a gentle, fragrance-free moisturizer. And in general, fragrances can be irritating. So you want to avoid products that have fragrances if you can. So those are some things to just improve the appearance of your skin in general, and also the way your skin feels. I mean, if it's dry and itchy and you change some of your habits to, warm water, moisturizing after you come out of the shower, etc., that could alleviate some of those symptoms. And
what about, I'm sorry, but what about, like we talked earlier about wrinkles, all right? And there's all kinds of stuff out there that says, use this and your wrinkles will go away. And I saw in your material something about retinoid. Is that something that people should be conscious of if you want to minimize your wrinkles, if you will?
So the retinoids have been shown to improve wrinkles because I believe they increase the production of collagen and elastin. So part of the reason that wrinkles occur is because, so you can think of your skin as like the covering, and under your skin you have the dermis, and within the dermis is collagen and elastin. So with UV damage, aging, the collagen and the elastin break down. So now you have a cover, but you don't have anything holding up the cover. So the cover starts wrinkling. So the reason, so to alleviate the wrinkles, you want to build back the collagen and the elastin. And one way to do that is with retinoids, because they stimulate the production of collagen. Renova is the prototype retinoid, but nowadays, there's so many different, patients have so many different options, all different price ranges. I mean, in the drugstore, you can pick up very good products with retinoids, with a retinoid. And
what about, I have friends that are taking it, the orally collagen, does that work, or are you familiar with doing that? It's everywhere. Everywhere you look now, it's, take your collagen. My friends are like, you got to take collagen. I don't take anything without expert advice.
That's the inside wrinkles.
So, I can't really comment about that because I'm not really familiar with what how oral collagen will affect your skin. I can't say that off the top of my head. I can't imagine how it could, but
well, according to the infomercials, you can take 50 years.
How about these things that go on under your eyes, like known as bags? Is there anything that can be done about bags under the skin, under the eyes?
Retinoid.
At an earlier age. I mean, once you have the bags, it's probably hard to get rid of them. But
okay, so I'm not an expert on cosmetic dermatology by any stretch, but I can kind of wing it for you, Otto, and say that that depending on what the cause of the bags are, is it from fat, or is it from wrinkles? The approach would be different depending on the cause. But I would recommend that you go to a board certified dermatologist who specializes in cosmetic dermatology, and the good news is I'm sure they can help with bags under your eyes.
That would be interesting.
So one other topic I know it is prevalent and really it's more unsightly that a lot of our seniors talk about, and I'm experiencing it, is rosacea.
Oh.
Rosacea, I mean, is that due to sun damage, or is that more of a, just a aging skin condition?
So when you have rosacea, you have your skin can get red your vessels are telangiectatic, they're dilated, and your sebaceous glands can be overactive. Sun will exacerbate the symptoms of rosacea. It's my understanding that some people believe it's an overreaction to, now you're going to love this. So we have mites on our face that are naturally, that are just, it's normal for us to have them. And some people who can get rosacea, and I believe that the thinking is that it might be related to a overproduction of these mites, or a reaction to the mites.
Mighty.
Well, I don't know how I feel about that. Maybe I should have asked you that question.
Well, you can use it as a positive. You can tell everybody you're mighty,
Very mighty, just on my chin. Got like a little bit of it, but it is, joking aside, it is something that is troublesome. And I know that doctors have, dermatologists do have all kinds of creams and things that tend to help. So I don't know if it's an anti-mite cream, but it is something that seems to happen a lot more, we notice, as we age. So any kind of information is definitely helpful. And of course, we hear constantly for everything to stay hydrated, like drinking water, staying hydrated, and drink 8 gallons of water a day. But I mean, it probably is better for your skin if you're hydrated. I mean, that would probably be something important to do. Is that something that yeah?
I would agree. Another reason that your skin might look dry and thinner or paper-like is because of loss of moisture. And that's another reason why we recommend to moisturize after a shower, because you still have your skin is damp, and then you put the moisture on, and the moisturizer on, and then the moisturizer holds in the water. So that's a local, a topical way to retain the moisture in your skin. But of course, drinking, I wouldn't recommend drinking 8 gallons of water, but
maybe in a month.
There is such a thing as water toxicity, just throwing that out there. But
right.
But yeah, you do want to stay hydrated. It helps with every organ system, I think.
So sort of a simplistic view of skin, which we're talking about, which we have a lot of, but it goes away as you get older. But it strikes me that the real number one thing is you got to be aware of trying to prevent skin cancer. And then number two, you try to do what you can as far as minimizing the things that happen because of age. You try to do what you can, but I think part three of that is that part of that is just the way it is. And you've got to age with some grace, if you will. Don't go for 40 facelifts and whatever. And try to, the facts of life are you're going to age. And maybe we don't like the idea all the time, but it is a fact. But to maintain good health,
Right.
detecting skin cancer is number one, I would say.
Well, Otto, well said. And, I do want to thank Dr. Mary Parisi for joining us today. A lot of really good information. And it's always good to have an expert such as yourself on, especially from Northwell Health. You're listening to Project Independence in You on 88.1 FM and WCWP.org.